Right, so GERD is gastroesophageal reflux disease. That's what it stands for, but it's most commonly what people call heartburn. And it affects probably about 20 million Americans.
What GERD is a disorder of the valve or sphincter at the end of the esophagus. Reflux itself is caused by a loose valve. So when that valve becomes sort of an open door or two-way street, that allows bile and acid to come up into the esophagus, which produces the symptoms. What you're supposed to have is a one-way valve down there that allows food to pass into the stomach, but then closes to prevent reflux from coming back up into the esophagus. The ideal patient for the LINX reflux management system are those patients with mild to moderate reflux with fairly typical symptoms of reflux, meaning heartburn,
Difficulty swallowing, nausea, bloating, regurgitation. Some people just describe it as a lump in their throat, what we call a globus sensation. There can also be associated symptoms in the respiratory tract, so just shortness of breath, wheezing, cough. Some people also have voice changes due to acid exposure to the vocal cords.
The LINX procedure, I think, is very successful because it's taken a completely different look at how to treat reflux. And what it is a magnetic bracelet made up of a little teeny magnetic beads. The force of attraction of these little beads keeps the end of the esophagus closed.
What these magnets do, so when you eat, they open and close, all right, and that allows food to pass normally. But when you're not eating, this reinforces that lower esophageal sphincter to help prevent acid reflux into your esophagus.
All the other treatments for reflux are trying to reconstruct a new valve. Traditional surgery attempts to reconstruct a new valve. The LINX device takes a different approach, and what it is doing is augmenting the native valve that's there. So it's not trying to reconstruct the normal anatomy that God gave us, it's just trying to strengthen the weak valve. And so I think that's why it's been so successful. Benefits to the patient for the LINX device are clearly the ability to belch, vomit, and swallow normally.
Having the LINX device now and being able to put that in laparoscopically, you can do it in 20 to 30 minutes. They get to go home the same day. The beauty about the LINX management system is that we want these patients to eat normally as quickly as possible. So we kind of want them to work out those magnets. Those magnets are kind of going back and forth.
The device has been helping about 75 to 80% of the patients that we've implanted since the beginning of the clinical trials. It's made a tremendous difference in the lives of these patients. Remember, these patients were on high-dose medications for their reflux without complete control of their reflux.
Hoag is currently the only hospital in Orange County that offers the LINX procedure, and one of only 3 hospitals in the entire state of California to offer it. My personal opinion is I think probably within the next 5–10 years, the LINX device will probably be the new gold standard.